Cardiologist warns, this pill is damaging the hearts of older adults. As we navigate through the years, the health of our hearts takes center stage, becoming an even more critical concern than ever before. Yet, what if the most significant threat to our cardiovascular well-being isn't found in our dietary choices, our stress levels, or even our inherited genetic predispositions? What if the real danger is lurking quietly within our own medicine cabinets in the form of commonplace medications? Leading cardiologists are now raising a serious alarm, not about obscure diseases or complex surgical interventions, but about the everyday pills that countless older adults rely on, often without fully comprehending the potential risks involved. We're talking about medications that have received the seal of approval from regulatory bodies, are prescribed by trusted physicians, and are widely utilized. However, within the aging body, these very same medications can insidiously elevate the risk of developing heart failure, experiencing a stroke, or suffering a sudden cardiac event. The most concerning aspect of this situation is that the majority of seniors are never adequately warned about these potential dangers. Prescriptions are frequently renewed automatically, side effects are casually attributed to the natural process of aging, and the dangerous interactions between various medications are all too often overlooked. But this widespread lack of awareness and proactive management is precisely what we aim to change today. In this comprehensive discussion, we will be meticulously examining 5 common pills that have the potential to inflict damage upon the hearts of older adults, with a particular focus on those aged 60 and beyond. Some of these medications you might recognize as familiar staples in many households, while others may come as a genuine surprise. Regardless, each of them warrants a closer and more critical examination. This is not intended to instill fear, but rather to present factual information, rigorously supported by scientific research, validated by experts in the field, and explained in clear, easily understandable English. If you are over the age of 60, or if you have a loved one who is, it is imperative that you pay close attention. The knowledge you are about to gain could be instrumental in safeguarding your heart health, preserving your independence, and in some instances may even prove to be life-saving. Let us commence our exploration with number 5 on our list. This particular medication is found in virtually every home and possesses the potential to quietly exacerbate your risk of heart failure, induce debilitating fatigue, and contribute to long-term cardiovascular damage. Number 5, ibuprofen and NSAIDs, the hidden strain on aging hearts. Medications such as ibuprofen, naproxen, and diclofenac are ubiquitous painkillers found in nearly every household. They are perceived as trustworthy, familiar, and readily accessible. When faced with the discomfort of arthritis pain, a stiff back, or a persistent headache, the vast majority of individuals reach for one of these pills without a second thought. However, once an individual reaches the age of 60, these seemingly innocuous medications can quietly transform into a significant threat to their heart health. NSAIDs, or non-steroidal anti-inflammatory drugs, perform a function that extends beyond mere pain relief. They also influence how the kidneys regulate salt and water balance within the body. In younger adults, the body typically possesses the resilience to adapt to these effects. Yet, with the natural decline in kidney function that accompanies aging, even when laboratory results appear within normal parameters, the body's ability to manage fluid and electrolytes can become compromised. This diminished kidney function can lead to the body retaining excess fluid. You might begin to notice symptoms such as swollen ankles, shoes feeling tighter than usual, or a heavy sensation in your legs. You may also experience increased fatigue as the day progresses. These symptoms are frequently misinterpreted as simply a consequence of getting older, but in many instances, they serve as critical warning signs. The retention of excess fluid places an increased burden on the heart, forcing it to work harder to pump blood. For older adults, especially those who already suffer from high blood pressure or have a pre-existing history of heart disease, this additional pressure can lead to a significant worsening of heart failure or induce dangerous fluctuations in blood pressure. The risks associated with NSAID use, however, do not terminate with fluid retention. These drugs can also constrict blood flow to the kidneys, thereby further impairing their function over time. Numerous studies have established a link between NSAID use and elevated blood pressure, kidney damage, and even an increased risk of experiencing a heart attack or stroke. Furthermore, the duration of NSAID use directly correlates with an amplification of these risks. The longer they are taken, the more pronounced the potential for harm becomes. It is also important to note that even short-term usage can be perilous, particularly when these medications are combined with other drugs, such as diuretics or ACE inhibitors. Such combinations can create a dangerously potent trio, severely compromising kidney function and significantly increasing the strain on the heart. What makes this scenario particularly insidious is the subtle nature of its onset. You are unlikely to perceive your kidneys struggling or your heart working overtime. The symptoms are often understated: mild swelling, a general feeling of tiredness, or occasional dizziness, all of which are easily dismissed as the inevitable effects of aging. Moreover, because NSAIDs are readily available over the counter, they are often not perceived as carrying serious risks. However, it is precisely this perception of harmlessness that contributes to their danger. If you are over 60 years of age and regularly use NSAIDs, it is highly advisable to consult with your physician to determine if they remain the most appropriate choice for your health needs. It may not be necessary to discontinue their use entirely, but opting for occasional use rather than daily consumption can make a substantial difference in mitigating potential risks. Depending on your specific pain management requirements, safer alternatives may be available, such as acetaminophen for certain types of pain, or topical treatments that do not exert any adverse effects on the heart or kidneys. Additionally, lifestyle modifications, including regular stretching exercises, heat therapy, or physical therapy, can also be highly effective in managing chronic discomfort. The ultimate objective is not to endure pain in silence, but rather to address it effectively without inadvertently creating more significant health problems. For older adults, NSAIDs might appear to be benign, yet they could be silently jeopardizing the health of their hearts. Now let us proceed to number 4 on our list. This particular medication does not fall into the category of painkillers, nor is it intended for joint or back discomfort. Instead, it is a drug frequently prescribed to alleviate insomnia or to calm anxious thoughts. However, for individuals in their senior years, it may be insidiously eroding their mental clarity, compromising their balance, and diminishing their overall independence. Number 4, benzodiazepines, the sleep aid that can steal your stability. If you have ever experienced difficulties falling asleep, staying asleep throughout the night, or managing intrusive and racing thoughts, your physician may have prescribed medications such as lorazepam, temazepam, or diazepam. These medications belong to a class known as benzodiazepines. For a great many older adults, these drugs can feel like a lifeline, offering solace from sleepless nights and a welcome respite from anxiety. They can provide a sense of normalcy, helping individuals feel more like themselves again. But what if this very same medication was also silently increasing your susceptibility to falls, contributing to confusion, or even posing a risk of long-term cognitive decline? Benzodiazepines exert their effects by slowing down the activity within the brain and the nervous system. This mechanism is precisely why they induce feelings of calmness, drowsiness, or reduced anxiety. However, in older adults, this effect can sometimes extend beyond the intended therapeutic range. These medications do not simply relax the brain, they also impair reaction times, diminish muscle control, and negatively impact balance. This combination of effects significantly elevates the risk of falls, particularly during nighttime hours when grogginess can be at its peak. It is crucial to understand that falls are not minor inconveniences for individuals in this age group. They represent one of the leading causes of serious injury, hospitalization, and the subsequent loss of independence among seniors. The dangers associated with benzodiazepines, however, extend even further. These drugs have been linked to memory impairment, a persistent sense of mental fog, and an increased risk of developing dementia when used over extended periods. What may initially manifest as mild forgetfulness or a slight difficulty concentrating can gradually progress into more significant cognitive issues. In many cases, individuals never connect these cognitive changes back to their medication. Furthermore, there is the significant issue of dependence. Over time, the body adapts to benzodiazepines, often requiring higher doses to achieve the same level of efficacy. Suddenly discontinuing these medications can trigger a withdrawal syndrome, characterized by symptoms such as heightened anxiety, insomnia, restlessness, and even tremors. This can create a detrimental cycle. The individual relies on the pill to achieve sleep, but the pill itself may be gradually undermining the very clarity and stability that healthy sleep is meant to support. So, what is the recommended course of action? Firstly, it is essential to avoid panic and to never abruptly stop taking the medication, as this can lead to dangerous withdrawal symptoms. If you are currently taking a benzodiazepine, your primary step should be to engage in an open and honest conversation with your doctor. They may recommend a gradual, supervised tapering off the medication or explore safer alternative treatments that do not carry the same inherent risks. Non-pharmacological therapies have proven to be effective in managing sleep and anxiety. For instance, cognitive behavioral therapy for insomnia, CBTI, is recognized as one of the most effective treatments for chronic sleep disturbances and does not involve any medication-related side effects. For anxiety, approaches such as mindfulness, deep breathing exercises, gentle physical activity, or even certain types of antidepressants can provide relief without the associated risks of impaired balance or memory problems. The fundamental understanding here is that not all instances of sleeplessness or anxiety necessitate the use of sedatives. For older adults, what may seem like a minor dose of relief can come with a substantial hidden cost. That small white pill that facilitates your descent into sleep might, in reality, be quietly diminishing your sense of balance, your cognitive awareness, and ultimately, your cherished independence. If you have found this video to be informative thus far, please take a moment to express your appreciation by liking, subscribing, and activating the notification bell. This ensures you will not miss future videos that delve into similar vital health topics. Now, let us transition to number 3 on our list. This is a medication taken by millions of seniors to address issues like heartburn and acid reflux. However, it may be contributing to weakened bones, depleting essential nutrients, and introducing new, often unaddressed health risks. Number 3, proton pump inhibitors, the silent drain on your heart and body. Heartburn, acid reflux, and indigestion are common complaints that tend to become more prevalent as we age. For a considerable number of individuals, the solution often arrives in the form of a small pill. Medications such as omeprazole, pantoprazole, and esomeprazole, collectively known as proton pump inhibitors, PPIs, function by significantly reducing the amount of acid produced in the stomach. For short-term relief from discomfort, these drugs can feel like a miraculous intervention. They can bring an end to the burning sensation in the chest, eliminate the unpleasant sour taste, and prevent pain after meals, all with the simple regimen of taking one pill daily. However, there is a critical piece of information that is frequently overlooked or not communicated to patients. These medications were never intended for long-term use, particularly not in older adult populations. Millions of seniors regularly take PPIs for months and sometimes even years without ever undergoing a re-evaluation to determine if their continued use is still necessary. Over an extended period, this seemingly innocuous daily routine can lead to a cascade of serious health consequences, some of which directly impact the heart, bone density, and overall physical resilience. One of the most frequently underestimated effects of PPIs is their interference with the body's ability to absorb essential nutrients. Stomach acid is not merely present to cause discomfort. It plays a crucial role in facilitating the absorption of vital minerals such as calcium, magnesium, and iron. When stomach acid levels are suppressed for prolonged periods, these critical nutrients cannot be absorbed efficiently by the body. A deficiency in calcium, for example, directly translates to weakened bones. In older adults, this condition significantly elevates the risk of fractures, with hip fractures being particularly concerning due to their potentially life-altering consequences. The impact of PPIs does not stop at bone health. Magnesium deficiency, which is notably more common among long-term PPI users, can disrupt normal heart rhythm, lead to painful muscle cramps, and contribute to symptoms like dizziness and pervasive fatigue. Insufficient levels of iron and vitamin B12 can result in anemia, nerve damage, or a pervasive sense of mental fog. All of these symptoms can be easily mistaken for the natural effects of aging, when in reality, they may be directly related to medication use. Furthermore, PPIs can affect the immune system. Stomach acid acts as a protective barrier against harmful bacteria entering the digestive tract. When acid levels are consistently low, the body becomes more vulnerable to infections, including Clostridioides difficile, C. diff, a gut infection that can cause severe diarrhea and dehydration, posing a particular risk to older adults. Some research has also suggested a correlation between long-term PPI use and an increased risk of kidney disease, dementia, and cardiovascular problems, although further extensive research is still needed in these specific areas. Nevertheless, the overarching pattern is becoming increasingly clear. The longer these medications are taken without a thorough assessment of their ongoing necessity, the more the potential risks begin to outweigh their benefits. This is not to imply that PPIs are inherently bad medications. They are remarkably effective, and in many clinical situations, they are absolutely necessary, particularly in cases of active ulcers, esophagitis, or specific gastric conditions. However, what should ideally be a temporary treatment often evolves into a permanent, habitual reliance. If you have been taking a PPI for a period exceeding a few months, it is highly recommended that you discuss this with your doctor. It is possible that you still require the medication, but it is also possible that your need has diminished or been resolved. In some instances, a transition to lower dosages, intermittent use only during symptom flare-ups, or a gradual tapering off under medical supervision may be appropriate. The crucial takeaway is that immediate relief should not come at the expense of your long-term strength, your physical balance, and your overall resilience. Now let us move on to number 2. This is a medication that is ostensibly designed to safeguard your heart, but when taken at the incorrect dosage or in combination with other drugs, it may in fact be placing it in jeopardy. Number 2, heart and blood pressure medications, when the cure becomes the risk. When contemplating medications that can potentially harm the heart, pills prescribed for blood pressure typically do not immediately come to mind. In fact, their primary purpose is to offer protection, to lower blood pressure, reduce strain on the heart, and enable it to function more efficiently. For millions of older adults, these medications are absolutely essential for managing their cardiovascular health. However, there is an uncomfortable truth that needs to be acknowledged. The very same medications prescribed to protect your heart can, under certain circumstances, also pose a risk to it. This is particularly true if the prescribed dose is too potent, if the combination of medications is overly complex, or if the individual's physiological state has changed significantly since the prescription was initially issued. Let us begin with diuretics, commonly referred to as water pills. These medications assist the body in eliminating excess fluid and salt. They are frequently prescribed for conditions such as high blood pressure and heart failure. However, in older adults, diuretics can lead to dehydration, dangerously low potassium levels, electrolyte imbalances, and feelings of dizziness. That pervasive sense of tiredness and lightheadedness experienced when standing up might not be a symptom of aging itself, but rather a consequence of your water pill overexerting its effect and depleting your system. Then we have calcium channel blockers, which work by relaxing the blood vessels to decrease blood pressure. In some elderly individuals, however, these can cause swelling in the legs and ankles, excessively slow the heart rate, or contribute to feelings of fatigue and cognitive fog. Beta blockers, another widely used class of heart medications, can present their own set of challenges. While they are effective at slowing the heart rate, which is often beneficial, in some individuals, this effect can become too pronounced. This can manifest as shortness of breath, cold extremities, and a reduced capacity for physical exertion. In individuals with diabetes, beta blockers can even mask the warning signs of low blood sugar, creating a hidden and potentially dangerous situation. The reality is that the human body undergoes significant transformations with age. Blood vessels tend to stiffen, the kidneys filter substances at a slower pace, and the body's ability to regulate salt, water, and blood pressure shifts. This means that a dosage that was perfectly appropriate and effective at age 55 may now be too high and potentially harmful at age 75. Moreover, the issue is not solely about individual medications. Many older adults are prescribed multiple heart medications simultaneously. This often involves a beta blocker, a diuretic, a medication to regulate heart rhythm, and another to manage cholesterol levels. The cumulative effect of these combined medications can quietly overwhelm the body's systems. This phenomenon is known as polypharmacy, and it is an alarmingly common issue among seniors. One medication may be prescribed to counteract the side effects of another, creating a complex web of prescriptions that the body must constantly manage. Before long, an individual might be juggling 6 or 7 different medications. When this occurs, individuals may begin to feel unwell, experiencing brain fog, weakness, or a diminished sense of stability on their feet. It is tempting to attribute these changes to the natural aging process, but in a significant number of cases, the underlying cause is medication overload. And when heart medications begin to interfere with balance, kidney function, or energy levels, the risk of hospitalization increases, not necessarily due to the heart condition itself, but due to the complex and potentially detrimental effects of its treatment. To be absolutely clear, these medications can be life-saving, but they must be subjected to regular reevaluation, rather than simply being renewed out of routine habit. The ultimate objective is not merely to achieve ideal numbers on a chart. The true goal is to empower individuals to remain sharp, steady, mobile, and independent. If you or someone you care about is over 60 years of age and is taking multiple medications for blood pressure or heart disease, it is essential to ask critical questions. Are the current dosages still appropriate for my body? Are these medications working in harmony with each other, or are they creating conflicts within my system? Because while the right heart medication can be a life-saving intervention, the wrong combination can insidiously diminish your quality of life piece by piece. And now we arrive at number 1, arguably the most dangerous pill of all. Its danger is not derived from its individual identity, but rather from the sheer quantity of them that are being consumed. Number 1, polypharmacy. The most dangerous pill is all of them. If there is a single factor that poses the most significant threat to the health and well-being of older adults, it is not one specific pill, but rather the collective burden of taking multiple medications. Polypharmacy, defined as the concurrent use of 5 or more medications, has emerged as one of the most perilous and frequently overlooked threats to senior health, and its prevalence is astonishingly high. In fact, numerous studies indicate that close to half of all adults aged 65 and older take 5 or more medications on a daily basis, with many individuals taking considerably more. Consider this scenario: a pill for blood pressure, another for cholesterol, something to aid in sleep, a medication for pain management, an acid reducer, a dietary supplement, and a mood stabilizer. One prescription often leads to another, and then another, until an individual's body is engaged in a complex juggling act with a mixture of drugs that have never been comprehensively tested for their interactions, particularly not within the physiological context of an aging system. And here is a critical piece of information that is rarely communicated. With every new medication introduced, the probability of experiencing side effects escalates. Each combination of drugs amplifies the risk of potentially harmful interactions. And every additional pill places a greater strain on the kidneys, the liver, and the heart, making it more challenging for these vital organs to function optimally. The consequences of polypharmacy are not always dramatic or immediately apparent. They are often subtle: increased fatigue, a diminished sense of stability, progressive memory lapses, a slowing of the digestive system, or shifts in mood. Many individuals, faced with these changes, tend to assume they are simply the unavoidable effects of aging. However, in a significant number of instances, this is not the case. The root cause can be the medications themselves. Perhaps the most disheartening aspect of this situation is that many of these prescribed medications are, in fact, no longer necessary. They may have been prescribed months or even years prior and have never been reassessed for their continued relevance. In some cases, the original medical condition may have resolved or changed, while in others, the side effect of one medication is being managed by the prescription of yet another. This creates a silent downward spiral, not towards improved health, but towards increased fatigue, frailty, and dependence. Polypharmacy does not merely place a strain on the heart. It can insidiously steal your mental clarity, deplete your energy reserves, and undermine your hard-earned independence. The solution is not to abruptly cease all medications. Rather, it is to undertake a thorough and comprehensive review of every single medication. A skilled physician or pharmacist can assist you in meticulously examining your medication list, identifying any prescriptions that are outdated or no longer serving a necessary purpose, reducing the number of unnecessary drugs, and adjusting dosages for those that are still vital. The outcomes of such a review can be profoundly life-changing. Reduced dizziness, increased energy levels, improved focus, a clearer mind, fewer falls, decreased hospital visits, and in many instances, a rediscovery of your former self, perhaps for the first time in years. Because true health is not always about adding more interventions. Sometimes it is about gracefully letting go of what is no longer beneficial or essential to your well-being. If you or a loved one is currently taking 5 or more medications, do not delay. Schedule a comprehensive medication review. Do not hesitate to ask the difficult questions. And most importantly, be an active advocate for your own health. The most dangerous pill might very well be the one you have been taking without realizing its potential for harm. If you have found this information to be valuable, please show your support by liking this video and subscribing to our channel so you can stay informed about future health insights. We are dedicated to breaking down complex health topics like this every single week. In the comment section below, we encourage you to share how many medications you or a loved one are currently taking. Have you ever questioned whether they are still necessary? Your personal experience may offer crucial guidance and comfort to someone else. Furthermore, remember that sharing this video with a friend or family member could be the vital first step in helping them protect their own health.